Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. I'm joined today by my co-host, Dr. Johanna Richey. Hi, Joe.
Hey, Jeff.
How are you doing today?
Doing great. A beautiful day in the desert.
Absolutely. Well, we have a fabulous guest today. I was trying to think about the best way to introduce you, Dr. Yoho, and the best thing I could come up with, you've been there and done that in all things podiatric medicine. How's that sound?
That's a pretty fair assessment. Let's keep it to that.
All right, sounds good. Dr. Yoho, we are informal here on Dean's Chat, and if it's okay with you, let's go with Tim, Joe, and Jeff. How's that sound?
Perfect.
Sounds good. So when I said you all things podiatric medicine and you've been there and done that, I thought the first place we should start is with your retirement. How are you adapting to Des Moines, CrossFit, working out every day and being retired?
Yeah, so, if we kind of, back it up a little bit, I think the things that influenced my retirement were kind of just as you mentioned, Jeff, that was, I felt I had done everything I could do that I wanted to do in my career at Des Moines University. They had an upcoming accreditation visit in about 18 months. They were planning the big move to the new campus, and I just felt for me, there were some other things that I wanted to accomplish outside of podiatric medicine. So it seemed like the perfect timing for me, and I think I left it in good shape heading into that accreditation visit. And from what I understand, they did well by CPME in that visit a year and a half ago.
Yeah, I talked to Dr. Smith. He said they sailed through, no problem.
I mean, the other thing that I wanted to do was, sort of a shameless plug. You can see with my background that I don't have my book or anything like that. All the political pundits have. But one of the things I wanted to do was I wanted to write a book, a memoir about my son, my daughter-in-law, and my granddaughter. And so that was first on my list of things to do. And I kind of knew if I didn't do it at the time I did it, I don't know that I would have followed through on it. So in my mind, I was set to get started immediately after retirement.
That's great. Tim, for our listeners, would you mind sharing a little bit, maybe a Cliff Notes version of your book? Because it's fascinating. It's a great story.
Sure. So it really is about kind of family members of mine and some of the challenges that they faced when they hear the devastating news of someone being diagnosed with cancer. So my daughter-in-law, about 4 months before their wedding to my son, Nathan, she was diagnosed with a glioblastoma. And so the book sort of walks you through her diagnosis, her treatment, and eventual death. But part of that book also is about the birth of our granddaughter, who was born 4 months after her mother had passed away through a surrogate who had volunteered Nathan and Laura that she would carry for them. And her name was Kara. It was Laura's best friend since second grade, and she approached them and said, if you'd like a child, I would be willing to carry for you. And so we're extraordinarily grateful to Kara and her family. And so the book really is about the process that they all went through, ultimately resulting in the birth of our granddaughter, Caralyn. And so that's what the memoir is about. The one thing is, this wasn't the purpose, but I think it's a really good book for any student in health professions to read, just about what they encountered from various healthcare professionals, instances of outstanding communication and compassion and caring, and maybe some instances where it was less than what they expected. So I think there's some really good secondary learning lessons for people in the book.
Very good. It's excellent. Congratulations on that. For our listeners, where can they find the book, the name, and we know the author?
Yeah, the book is called Life After Death, the Laura and Carolyn Yoho story, and can be found on Amazon and Barnes and Noble. Pretty typical outlets that publish books.
That's fantastic. Joe, your thoughts?
Yeah, what an amazing tribute, and what a nice opportunity to capture that history for. Did you say her name was Caralyn, your granddaughter?
Yeah.
Like just so many different opportunities in that to look at your life, look at your son's life and his wife, and then find these parallels that you can look at through how we deliver healthcare, how we treat each other. I think that's beautiful.
Yeah, she's 10 years old now. We actually have started to read parts of the book. There are sections and chapters that I don't think she's at a position in her life where she could process some of the things, but there's a few chapters that we'll pull out and we'll take some time reading through those so she understands. And that really was one of the points of the book, was to document her life in terms of all the sacrifices and how much love existed that brought her into this world. So, and we look forward one day that she'll be able to read that book and ask questions and understand it completely.
Incredible.
What a gift.
Yep. What incredible. That's awesome, Tim. I'll shift gears a little bit here. So you were the longtime dean at the Des Moines University College of Medicine and Surgery, and podiatric, of course. And when you became the dean in 1997, you had some unique challenges. Des Moines was trying to get on the map, and 25 years, I'm sure, went by like a blur. But when you were retired, Des Moines is one of the finest podiatric medical schools in the country. Can you share with us some of the challenges that when you became the dean that you had being integrated with the DEAL program and the growth of a new program?
Yeah, one of my mentors is Dr. Richard Ryan, who was the president of Des Moines University at the time. And so they were going through some changes, both at the university level as well as at the college, and the dean had stepped down. And I had been there, I started there in August of 93. And so this would have been in 97 in October, where the dean had resigned, and he called me into his office and he asked me if I'd be willing to serve as an interim dean. And so I was pretty much clueless at the time in terms of what the duties and responsibilities of a dean would be. So stupid me said yes. And one of the things I didn't understand was accreditation. No one ever told me that we had an accreditation visit coming up in less than a year. And so we got started on that immediately, and it was January 1st. So after 3 months, he called me in again and he said, I don't want to go through a search. I'm just going to name you as the dean. I accepted. I'm not exactly sure why I did at the time, but I think it probably had more to do with, when somebody expresses confidence in you, which Dr. Ryan did for me, I think you have the support that you need to be successful. So I think the reason I agreed to take on the deanship at that time clearly was here was an individual who had an outstanding academic career, and for him to put that kind of faith in me just sort of told me that he's here to help me out, and he did all along the way. I think some of the challenges were with that first accreditation visit. I would have to count on both hands the number of areas of potential non-compliance that the letter came back with. And so, I sat down with Dr. Ryan and members of the faculty and said, I remember saying to them, we need to deal with this, and this will never happen again. And it never did happen again after that. And I think some of the challenges that the College of Podiatric Medicine and Surgery faced early on, it really was the first podiatric program that was affiliated with an osteopathic medical school. And so I think that there were some real challenges there on both parts. and that is an osteopathic program that was used to being just purely osteopathic, and a podiatric program that felt, well, we should be accepted immediately. And so I think part of it was the students and maybe even the faculty felt at times they were looked upon as second-class citizens. And I remember a meeting with the students saying, don't let anyone ever tell you that you are a second class at this institution, but you have to prove yourself. And you do that by having exceptional outcomes, such as your board scores, your residency placement, your behaviors, your professionalism, our graduation rate. And so, once we had that conversation with students, I think they understood the path to acceptance, and that was excellence. And I think that doing that, we were able to overcome a lot of hurdles. And so I think in a very short time, the program became very respected at Des Moines University. I don't think a new program shows up on a campus and it's like, ta-da, podiatry is here.
Right.
I think you have to prove yourself. And Jeff, you probably went through some of that at Midwestern early on, but hopefully not nearly as long as it took us at Des Moines University.
I know Jeff Page was after you, of course, and starting a program with the DO school. And Johanna was one of the first graduating classes. Johanna, you remember those days being thrown into the mix with the DOs.
Yeah. It's interesting. And I have to say, Tim, I just wrote down what you just said because I love it so much. The path to acceptance is excellence. Wow, that has so much power. And it's so true, right? We have this unique opportunity as a specialist to shine. And every single one of us is a representation of our profession. Whether we choose to be or not, you are. And the best way to represent is through excellence. Doesn't mean you have to, get out of your lane for the terminology that sometimes people will throw around. You don't have to master all of the things that are not podiatry. It's not our spectrum. It's not our scope. But being excellent at what we do and representing who we are and what we are capable of doing. Wow, I thought that was like I had to stop and write. I don't usually write down notes while we interview people, but I thought that was really powerful. And yes, being integrated with the DO program, I think was such an important step for our profession. So I thank you for taking on those challenges and headaches. I can only imagine how that shaped out. If you're willing to kind of highlight some of the things that were challenging, I would love to hear, and I'm sure the audience would love to hear some of the kind of initial, not hurdles, but clunkiness of it.
Yeah, I'm a James Collins fan, good to great, and the philosophy of a flywheel, and that is, you just start gaining some momentum. And then the more you're able to accomplish, I think the quicker that flywheel goes, then you can then just expand your successes, within the institution and also within the profession. I think one of the biggest challenges was trying to convince, the osteopathic program, why are the DPM students taking these same courses, particularly anatomy. I remember, a student approached me one time and said, I'm in an anatomy group and there's 3 osteopathic students and myself, and they've sort of asked me, why are you bothering to do head and neck? And I said, well, it really comes down to their tone in terms of how you're asking that. There's a number of different ways that you can interpret it. I said, but regardless, I think it's important for you to educate them. And you can do that by saying, yes, you're not going to treat, the head and neck, but yet there are relationships and conditions affecting the head and neck, the eyes, for instance, that may be related to something that's going on, to podiatric medicine. And as a DPM, you may be the first one to diagnose an issue with eyesight. You may be the initial contact for diagnosing somebody with diabetes or hypertension. And then I said, all you can say to them is, if I make that diagnosis, I'm not interested in treating it. My license doesn't allow me to treat it. I understand that, but maybe I'll refer this patient to you. And so it's like, if you're able to educate, folks who aren't quite sure about why you're doing what you're doing, I think that's only a positive thing for your profession. And I think it builds a collaborative spirit, which is important. And I think that was one of the challenges, was just trying to build a collaborative spirit between the different programs at Des Moines University. I think another challenge was, that we weren't doing a lot of research. And I think that's because a lot of the faculty had not participated in any research in the past. And I think what they were trying to do was, to create 5-star research, to reinvent the wheel. And so in working with them, it's, let's just start out with singles and doubles, try to publish a case study, a series of cases. And then once you have some success, again, maybe the next thing you try to do is a case control study, or you do some bench research. So I think that was another area that we were challenged with in terms of sort of gaining credibility within the institution. But more importantly, I think gaining credibility in the profession that, here's an academic program that actually their faculty are publishing. So I think those are probably two major hurdles I think that we had to face early on. But ultimately, I think we're successful in overcoming both of those, I'll call them challenges, but they were probably frustrations as well.
Absolutely. Well, you got the ball running all right. You did 36 publications, I saw, and well done.
Well, I had a lot of help along the way, which is kind of interesting because, after, how I got into podiatric medicine is a story in and of itself. But one step was, after I wasn't sure what I wanted to do. I graduated from college. I went to graduate school at Duquesne University, graduated with a master's degree in biology, microbiology. And then I took a position at the University of Pittsburgh School of Medicine and School of Public Health. And I worked really with an outstanding faculty member, Dr. Aurelia Koros. And we were working at the time with interferon and small cell lung cancer and the effect of interferon on various cell lines. And so we actually would grow the human tumor up in an animal model. So when I went after that, I decided the PhD students at Pitt, because I applied to the program and was accepted, they said, you don't really want to do this because I don't remember if it was late Carter or early Reagan administration. Funding was a bit thin, and they said they keep their PhD students around here a long time. And
Gotcha.
So they actually discouraged me from attending. So I sort of looked around and said, did a 360 on myself and thought what might work best for me. And I landed on podiatric medicine. When I finally graduated from Ohio College of Podiatric Medicine, now Kent State, I did my residency in Toledo. I went to private practice in my hometown, and I liked private practice. But after 7 years, I'm gonna bring this all together here in a second.
It's good.
One day I went to my wife after 7 years, Donna, and I said, I like private practice, but I will be disappointed in myself if that's all I do. And she said, well, why was that? And I said, when I was at the University of Pittsburgh, I developed a really strong set of research skills. And I said, if I don't use those, and I know I won't use them in private practice, I'll be disappointed in myself. And that really sparked my interest in looking at a faculty position and how I ended up at Des Moines University. And so when we talk about research as being a hurdle for the faculty, I felt pretty comfortable that I could assist them in terms of just gaining some confidence and wanting to participate in different research activities. So that's kind of a long story long in terms of why I felt research is really important from the schools of podiatric medicine and how it relates to my background.
That's interesting, Tim, because we had a strategic planning meeting yesterday, and we went around the table and talked about all the different research programs and projects people were working on with students. And really, it's a hallmark of a school, the production of research that advances a profession.
Yeah.
Joe, your thoughts?
And I also love that you had gone into it with this mentality of you knew there was something else. Maybe you couldn't put your finger on it, what it was, but that moment of, again, looking at life as a whole. When a lot of students listen to this, a lot of prospective students, residents, sometimes you can't put your finger on what it is, what the itch is, but there's something that you feel like you need, and being willing to take that risk to go out and try to find it and be able to wrap it in a framework to try to start answering, okay, what is it that I'm feeling? I miss the research. I miss that part of being in academics, having that intellectual conversation or curiosity. And so then being able to find it. And I would love right now, if we could kind of, if you don't mind, Jeff, some of your publications I found incredibly fascinating, because there are a lot of things that we have looked at or thought about and talked about on a very regular basis in academics, looking at things like the relationship between academic performance and self-assessment in clinics, looking at things like MCAT scores and academic performance in their first 2 years in school. So I would love to get your take, or kind of how these things came about, and how did you start these projects, and if you can talk to the audience a little bit about maybe what you guys found, big picture stuff.
Yeah, I think one of the first studies that we did was a comparison between the performance of the DO and the DPM students in the first year curriculum, and it was a relatively easy study to perform, because the students all take the same curriculum with the exception of maybe 1 or 2 first-year courses that are program specific. And so we kind of know what their GPAs and their MCAT scores are, and we know how they perform in all these courses. And so the first course that they took, and probably one of the most challenging, is biochemistry. And the last course that they took together was the pharmacology course in the second year. It really was the only course that they took with the DOs. And so we sort of looked at all those things. And what's interesting is what we found out was, in looking at the first year, there was a significant difference in terms of different academic benchmarks, and even in the performance in the biochemistry course. And even in the 4-year graduation rate, although it wasn't that far apart, it was just a few percentage points in terms of graduation rates. But when we looked at the pharmacology course, and this is after they all had completed the first year, the scores between 220 DOs compared to 50 DPMs, there was no difference in their performance. And I think, in my mind, that was an academic landmark study for our profession that said, at least at a certain point in the curriculum, our students, in terms of their academic fortitude, are no different than the students in the College of Osteopathic Medicine at DMU, which, quite frankly, has an extraordinarily strong record. The osteopathic program at Des Moines University is well known for its academics and its student performance on their national boards. I think they were number 1 in COMLEX last year, and they've always been in the upper echelon of board scores in COMLEX and in other metrics for osteopathic medicine. So I thought that was, and the thing about it is, it's just a simple study. And I think the same thing with some of the other ones that we did that were related to academics, because when I did a search of sort of academic type studies for the profession, there was very little out there. So I thought, boy, that's a real market for the profession. The same thing with students looking at self-assessment and how important that was to them. So they understand areas where they need to improve upon and areas where they've performed well. So again, these are not, difficult studies to come up with. They're very simple, but I think they're very meaningful, and they help promote the profession.
Tim, we see something very similar, and part of what I think is going on is they develop some confidence, and then they do well, and then they have competence, and it's like a snowball. They just start getting more and more into it, and they know what it takes to be successful, and it becomes rinse and repeat in the basic sciences as the second year goes on. And I'm super proud of our students like yours. They do so well, and they fit right in with the DOs. And I think it advances our profession. There's no doubt.
Yeah, and I'm grateful to the osteopathic profession because they are the ones that really opened their doors to podiatric medical education, and so they certainly didn't have to do that. But I think it's been a great relationship over the years that will continue.
Absolutely. And, it's funny when we were talking about parity a couple of years ago, and there was discussion about taking the USMLE. The first thing I thought of was it would make more sense to take the COMLEX since we have multiple schools affiliated with the osteopathic medical programs, which is a whole can of worms.
Not a bad idea. Not a bad idea, although, as far as our boards, I know that I think COMLEX has become very clinically oriented, where I think the podiatric boards continue to be some first and second order questions, maybe with a small percentage of clinical questions. So that's something I think at some point in time needs to be addressed.
Absolutely. Yeah, we probably won't solve all the issues right now.
No, I don't think so.
Dean's chat has the answers.
Yep, there you go. Yeah. So Tim, one of the things I've always admired you for is your forward thinking and your strategic planning and your focus on leadership. I mean, you mentioned James Collins. You and I have had multiple conversations over the years. You went to University of North Carolina, Chapel Hill, and got a leadership effectiveness. Was that a certificate or a degree? What was that?
Yeah, that's one of those sort of week-long seminars that, like the Harvard Macy,
sure,
in terms of leadership. Only this really was pretty much, they were all MBAs in there, and then this sort of lone DPM. And so I got that idea really from reading a paper by James Collins saying, look outside of your profession for new ideas. And so in my mind, it gave me the idea, the concept of medical school is an academic business model. I mean, I think we all have to agree with that. Yeah. We'd like to think that it's strictly an academic model, but it is an academic business model. And so when I reached that conclusion, I thought, if I were to go and spend a week somewhere, where would I want to go? And I thought, you know what? I've heard some really good things. I think maybe Dr. Ryan actually talked to me about that. When I brought the idea to him, he said, well, I think there's some type of a program at the business college at Chapel Hill. Why don't you take a look at it? And so I did and attend that. And, I came away with a lot of really good ideas that I was able to share with our faculty and bake into our strategic plan at that time.
So if your leadership style, Tim, how would you describe it?
I'm kind of all over the place. I don't know that I could pigeonhole myself in terms of one particular area. I like to think I've sort of developed my own style, and that is, expectations, performance, guidance, and most important to me is fairness. So, rather than sort of use the traditional categories of 5 or 6 leadership, I think I've tried to develop my own style that probably at times includes a mix of all the different traditional ones that are out there. But I think kind of looking at an issue or a problem from a fairness perspective has always served me well. I've always tried to put my own personal interest aside when it comes to making decisions and trying to do what's best for the greater good rather than for any one individual.
That makes sense. And you really, one leadership style doesn't work in every situation, as you said. No. So you grow with that. I'll never forget in 2010, Tim, I was about to become the dean in Miami, and you and me and Jeff Page went out for dinner in Seattle at the APMA meeting. And you gave me some words of wisdom. You said, Jeff, realize that you'll never make everybody happy. And I've remembered that ever since, Tim.
Yeah, that's a pretty common theme.
Well, that's true. Yeah, it doesn't matter what you're in. There's no doubt. Joe, any thoughts right now? And then I wanted to roll into Tim's, what you've given back to the profession, Tim, through all of your advocacy and leadership roles.
If we can stick on leadership, and as you transition into leadership roles, we can go there. But I would love to get your take, Tim, on leadership in the face of adversity, or not contention, but conflicting opinions. And like, what were some tools or tactics that you used to bridge those gaps or handle those situations?
I mean, I think it's important to understand the first of all, I think being open-minded, being fair, I think willing to put yourself in somebody else's position and trying to view the issue from how they're seeing it. I've always tried to do that in terms of having conversations with people and trying to understand, where they're coming from, and hopefully a willingness on their part to listen to me and to listen to my key points and to find out if we can come to, a mutual agreement. I think there's a really key word also when you feel as if you're really frustrated and you just can't get to where you need to be. There's still a way to get there, and it's called finesse. And I think that people I don't know if it's a learned skill or not. I think it probably is over time, but I think I got to be fairly proficient at finessing in terms of, getting what we need for our program. A really interesting example was there were no residency programs in Des Moines, and there are some rather large medical centers. And so I did a couple of things. Number one, I went to the president of the university and asked would they, be willing to participate in at least early funding of a residency program, and they agreed. And then I met with a couple of DPMs at one of the major medical centers and talked to them about starting a residency program. Would one of them be willing to be the residency director? And they agreed, and they moved this forward with their administration. The administration agreed, but they weren't willing to fund it, at least until all the Fed funding came through. And so I also went to the Iowa Osteopathic Association and talked to them about would they be willing to participate in funding a podiatric residency program. And I had networked well enough and made connections that I think I found the support for it. So at the end of the day, we started a podiatric residency program at a primarily allopathic institution that was funded by an osteopathic foundation. So, I mean, the likelihood of that happening was unlikely. But I think if you develop a network and those personal relationships, those types of things can happen. So you can't just hit a brick wall and walk away. You sort of have to figure out, there's a couple of ways for me to get around this wall. And I think that's what you have to do is be patient, understand who you're working with, and try to develop a plan that you think that will satisfy all involved. And ultimately you may be able to get what you want. So I think being able to finesse is really important, particularly when you're dealing with challenging and frustrating situations.
We'd like to think it's a learned skill, but some of it's innate, I think. The finesse and the relationships and all that.
Maybe that comes with time, I don't know.
No, maybe. I agree with you.
You get your nose bloodied a few times and you say, hey, I got to do this a little bit differently.
There you go. Oh, well said.
This is not working.
I'm with you. Hey, you were a board of director with the American Association of Colleges of Podiatric Medicine for 25 years, and you were the chair from 2012 to 2014. For our listeners, the AACPM is the educational arm of the profession. How'd that over time, Tim, if you were to look back and look at a timeline, how did our profession change educationally over those 25 years?
I think it probably has more to do with the association's relationship, maybe with the Council on Podiatric Medical Education, in terms of developing, a common set of student learning objectives, educational domains, the change in the residency programs, and working closely with the council. I think that was important in terms of moving from, the preceptorship era to the one-year program to the alphabet soup of podiatric residency programs to now at least establishing a 3-year program with just a slight modification between the training between the two different sets of 3 years. So I think that was important. I think one of the difficulties, with the association is it's not a large number in terms of schools now, 11, and we had some common challenges that we all faced, but then it seemed that each program had its own individual challenges that they needed to overcome, and I think very much different from the other programs. And I think that made it a little bit difficult at times to try to find consensus in terms of making decisions for the association. And I think that was probably one of the things I was disappointed when I concluded my deanship there was I always would ask a student in an interview for residency, I see you were the president of your class. Tell me 3 things that you accomplished by being the president. And if they aren't able to tell me anything, then they were a name and only for that position. So I did feel that I didn't quite accomplish everything that I wanted during that time. And maybe it has to do with taking into consideration all of the programs, all the colleges and all of their needs to sort of focus on 1 or 2 issues and try to solve those, rather than, as we were talking earlier, we're going to solve every issue with podiatric medical education on this podcast. We're not.
Right. Right. It's interesting that you say that, because those same divergent needs for different programs change over time as they evolve and as they get more mature. Because as you know, we have 2 new schools on board. So there's always going to be challenges like that. But I think I agree with you. And Joe, you don't remember the alphabet soup days. You were a little girl at the time. But, by the time you got in the mix, there was the full 3-year surgical and medical residency program, and you benefited from that.
True. I am older than you think, though. I was in that transition of the PMSR 24 to PMSR 36. So I was a little bit in the alphabet soup, but not quite to the degree.
I was going back to the early 90s, actually.
Oh, okay. Yeah, no, that was me.
Well, okay. So Tim, nice segue there, right? You were involved with the Council on Podiatric Medical Education for 10 years or so. And you were also the chair, if I'm not mistaken, 2009 to 2011. That seems to me you dig your heels in a little more and get involved with everything podiatric medicine.
Yeah, it's really interesting because it's such a small profession. You see a lot of the same faces that serve on a lot of different important committees or boards throughout the organization. I have a lot of respect for the Council on Podiatric Medical Education for the time that individuals on the various committees, and I spent a lot of time on the accreditation committee and the council. I mean, how much time and effort is put into trying to do the right thing? And so people, I think, sometimes are disappointed with some of the decisions that are made. But I can't fault the effort of individuals who serve on those organizations. And so, one of the things I do believe that we were able to accomplish during my time was, I think in the past, the council was viewed upon as adversarial. That it was, we have a visit coming up, the council's coming, and this is viewed as a bad thing. I think the council sort of changed its approach, or maybe the program's perspective of the council has changed. I think they're more supportive. I think they want colleges to succeed. I mean, they're bound by the standards and the requirements in, 120. And they should, stick to those and have expectations. But I think they're more supportive in trying to assist programs reach those and meet those standards and requirements, more so in the past of just pointing them out and maybe not offering any assistance in terms of how they might go about resolving some of the issues that they're facing following a site visit. So I have a lot of respect for CPME. I don't necessarily agree with every decision that's ever made, but I really credit and value the effort that everyone puts in to participating in those organizations.
I say this tongue in cheek, but there's a correlation between deans retiring and a site visit coming up.
Well, enjoy your time. Start planning. Then you should start planning.
I understand. So, we've got another segue. Joe, you wanted to comment on CPME? We were talking about the 320 today in residency requirements.
Yeah. No, I think it's such a beautiful thing. With age comes wisdom, right? Like the older I get, the more I realize nothing is black and white. There almost isn't even black and white. Everything is a shade of gray somehow. And the more you think that you know something, you start to learn more about it and you realize how complicated, how nuanced, how much background support that you had no idea was going. Like how many people, to your point, Tim, are behind the scenes with really good intentions. And there are a lot of factors. There are a lot of variables. And so to your advice that you gave Jeff, you're not going to be able to make everyone happy. But if we can make decisions steering the ship in the right direction for the greater good, one foot in front of the other, again, that is a course that's set up for success. And it's interesting, right? As you start to learn and peel back the layers of the onion, how challenging that really can be. So I appreciate your insights on and your humility in terms of, your approach to all of that.
Thanks.
So Tim, on Dean's Chat today, we're going to make you the czar of podiatric medicine.
Okay.
And what do you think we need to do to, we've got some challenges. We've got student recruitment issues. We've got multiple schools. We've got different sizes of schools. Lots of challenges. Well, what kind of challenges and what would you do if you were in charge of the entire profession?
Well, first of all, I'm not, and I'm glad.
No pressure.
This is.
I think the profession needs to be realistic and understand the circumstances. So we know right now one of the biggest challenges is the applicant pool, the size of the national applicant pool, and we know that most students who go into undergraduate programs with the notion of going into medicine are probably thinking more allopathic or osteopathic or dental. I don't know that there's a significant population that goes into it thinking, I want to go and become a podiatric physician. And you don't hear very often about a family where their 6-year-old around the breakfast table says, I want to be a podiatrist. I would probably think that kid's weird. But you don't. So I think that we're also challenged by the sense that even at the national level, there are fewer students that are interested in the professions. We're in a downtime for all professions, and yet you continue to see an expansion of osteopathic programs and even allopathic programs, and so. So what you have from an economic perspective is you have more seats and you have less applicants to fill those seats, which sometimes creates an additional challenge for professions such as podiatric medicine. So you have to start looking, I think, at post-bac programs to say what can we do to encourage. Because it seems to me like the profession has done just about everything to try to encourage an increase in the applicant pool. I spoke to Jeff one time I looked at a couple of different professions. I don't want to be a ball hog here. I looked at orthopedic surgery and dermatology. And so the number of graduates of allopathic and osteopathic programs that go into those residencies is about the same number of DPMs that graduate every year and go into those residency programs. And even though there's a great need, I think we all would agree that we need more dermatologists, we need more orthopedic surgeons, we need more podiatric physicians. They just have not increased their numbers of residency programs to meet that need. And I'm sure there are a number of reasons why. So I think the notion that one day there's going to be 2,500 applications to podiatric medical schools will be very difficult to achieve. So maybe the alternative is you say, okay, this is what our applicant pool is. It's going to fluctuate over time. But maybe we lock in and say, this is the number of graduates that we're going to have every year, and we're going to give them the best education possible and then hand them off to the best residency program so that when you finish your residency, you are the best physician to treat foot and ankle disorders. So again, it comes down to quality. And I think sometimes we think too much in terms of quantity. Now, the drawback is, the smaller your numbers, the smaller your profession, maybe the less political clout that you have. But I think that can be counterbalanced by exceptional performance and outcomes and practice. And so I think we're sort of looking the wrong way in terms of we need to increase our applicant pool, because the fear out there is if you increase your applicant pool, you're going to increase the number of graduates. I don't know that that's the case, and I'm hard pressed to think over the last 40 years. I have an idea what the largest number of the applicant pool was, and it hasn't gone any higher than 1,500, and we know what the low points have been. I think given the current environment, the focus should be on quality of education. And I don't think we should worry so much about making the profession larger. And even when you add schools, maybe we should evaluate truly the quality of education that's being provided at all of the schools, and maybe set the benchmarks a little bit higher than what they are. And I think that's my perspective. If there's any solutions, is stop trying to compare ourselves to other professions, look at the data realistically and say, what is it that we can do to make this profession better? And by doing so, making it more desirable. So that's sort of my 2 cents worth as the czar of podiatric medicine over the past 30 minutes.
We went
I don't know if that makes sense at all.
But we went full
Completely.
circle, and we're back to excellence where we started.
Yeah.
Quality, excellence, top residencies, top students. It doesn't have to be 700 students for 550.
No, it doesn't. If you put
programs.
550 out there every year, and they are the best 550, and they're providing the best care, I think it takes care of itself. And I think it would sort of alleviate maybe some concerns on the part of our profession that, we're going to flood the market, with untrained DPMs. Focus on quality.
100%. Joe, your thoughts?
So if you were trying to counsel a student who's looking into different programs, what are some metrics that you could, or questions that they could ask to try to figure out what is a good program for me, or how do I find high quality academics?
From the podiatric schools, or just in looking at different professions as a whole?
From the podiatric schools. Like, how would you counsel a student?
Obviously, all the outcomes and things like that are posted, and I would say, you can go ahead and take a look at that. I think being investigative is really important. For some people, location is an important thing. I think that's a factor that certainly plays into it. I might want to find out what the size of the classes are. I might want to know what the history of the size of the classes are. Are they fluctuating? Are you going from 100 to 50 and back to 80 over time, or are you fairly consistent? Because I think we all know that the colleges, the schools are tuition driven, and you're going to make adjustments in your program and your resources based on your finances. And so I think I would look for consistency. I would tell a prospective student, look for consistency in a program in terms of every year, yes, they're filling their class, they're getting close to filling their class, and yes, they're graduating, 90% in 4 years and whatever plus percent in 4+ years. And so I think those are some of the things I would encourage them. If you have an interest in research, see what types of publications are coming out. So I think those are measurable things that somebody can look at. Otherwise, if you interview at 11 different schools, you're going to get 11 different opinions of why we're the best.
Absolutely.
And so it's strictly an opinion. And I can appreciate that, and I can understand that, and I did that. But I think if you're able to back those things up with metrics, I'm a data-driven person, and so I try to convince anyone to look at that type of information to help them make a decision. And I think applicants need to do a 360 on themselves, and then you can figure out what am I looking for and where is the best fit for me.
Well said.
Well said is right. Tim, we're running a little short on time. I wanted to touch base just for a minute on your CrossFit career. You've been like nationally ranked, right?
Internationally ranked.
Ooh, international.
Tell us more.
Right. So it kind of full circle. It goes back to the book. So my son and Nathan and daughter-in-law, one of the things that they wanted to do was they wanted to open their own CrossFit gym. And so they were members of a CrossFit gym. After Laura had passed away, Nathan was committed to that, and he opened his own CrossFit gym. What's really interesting about his gym is called CrossFit Merle Hay, shameless plug. And when you go in the gym, the thing you notice are the walls are gray, and the gray is there because it represents brain tumor. And the other thing you see is a logo, and it's a purple heart. It's a purple rose, and the purple rose is Laura's favorite color was purple, and the rose was her favorite flower. And so it's sort of a gym when you walk into, there's a lot of symbolism. And so the idea is when you're working out and you're feeling like quitting, just sort of remember, what this young lady and this family went through. And it kind of pushes you to kind of get past that wall when you're working out. And maybe you can carry that same philosophy into your daily life. And so Nate opened the gym. They just celebrated their 10-year anniversary. So they did give me a Yeti that had a 10-year member. And so I made it clear to everyone who was at the 10-year anniversary that I have paid a membership fee every month, the same as them. And I think even some months my credit card was tagged twice, but I didn't put up a fuss over it. But yeah, so I've been doing it for 10 years. I feel good. I feel fit. There were 3 years I did compete. I think 1 year I ended up in my age group ranked, I think like 70th in the world. A couple of other times I ended up in the top 100. But I'm sort of kind of gone past there. My knees starting to wear out. My shoulders are sore. And so I've sort of scaled things back so I don't hurt myself.
Fair enough.
But I would encourage everyone, regardless of where you go, keep yourself in shape, work out. I think that it helps you out, physically, obviously, mentally, and in the case of Nate's gym, spiritually. When you hear the story about what that gym is all about, he since has opened up 3 other CrossFit gyms, and they all sort of have themes related to them. So there's a lot of health and wellness and fitness in our family.
That is just an outstanding story, Tim. Thanks for sharing it.
Yeah.
Well, I'm going to send you one of these Dean's Chat cups, and I think I'm going to have Czar put on the side. And we appreciate you coming on the show. Joe, thanks, asking all those fabulous questions. But thank you,
Thank
Tim.
you so much. Yeah.
Joe, it was nice meeting you.
So nice to meet you too.
And if you send me that cup, if you have my picture on, would you please put a crown on my head?
Absolutely. Well, you send me a picture of you and I'll Photoshop it in, no problem. So to all of our listeners out there, if you're listening on Apple Podcasts or Spotify, please give us a 5-star rating. And if you're watching on YouTube, by all means, become a subscriber. Again, we appreciate you, Tim, for joining us on Dean's Chat. And cheers, everyone. See you next week.